floor manager, a wonderful, short, stocky Scotsman, took immediate action and dropped the first one. And he went to the ground, and the other one turned round and went back again. And they carried on introducing the Royal Show Sheepdog Trial final of 1976, I think. That was a year before Dog Show started.
Yeah. Someone obviously saw some potential in you despite the hijinks.
Yeah, probably. Whatever came out all right, and I'm very grateful to the man who selected me, and Tony Trotter, who got me into Country Calendar, then got me into documentaries, and did a lot of things for my career over the years.
Were you expecting it to be a hit?
No, we were really doing it for farmers, we thought.
And then when did you get wind that people were actually watching?
After about 2 or 3 weeks, I was on a radio station in Christchurch at that time as a rural broadcaster, and John Craig, the head announcer, said to me, this is going to be very popular. It is very popular already, and I think you're going to be quite well known. And I said, I don't think so. And I've been hiding ever since.
Now, I've received texts from 2 different people saying the same thing, and you can interrupt me if you think you know where I'm going with this. Both of them owned fox terriers.
Yes, and they watched the program regularly, so did cats, and I believe the odd budgie. Although I don't believe the budgie thing. It was about the whistling, I think, for the budgies.
Anything to the fact they're both fox terriers, or was it dogs of all breeds who'd watch the show?
Pretty much. I've got a collection of photos that were sent to me. None of them very professional, but fun photos. And the cats were the ones that I think wanted to get most involved. They generally had their paw on the head or the backside of a sheep, whereas the fox terriers and the odd beardie was crouching and watching intently.
Yeah, someone's fox terrier, Fred, now departed, would watch the whole show and get visibly frustrated when the ads came on. That's Margan Tamahere. And actually, someone else's fox terrier would growl at the TV, and whenever the sheep would disappear out of the camera view, she'd go behind the TV looking for them. I love that.
Yeah, that's not the only dog that did that, I understand, yes.
Yeah.
Well, we cater for all audiences.
I'm talking to John Gordon, commentator, host, and a later producer of A Dog's Show. When it came to commentating what you could see, were you just following your nose, or did you have a bit of a theory or a particular approach to it?
Not really, not at the start. I learnt a lot from the first year. I learnt to just try and shut up in between times and try and time and place commentary, but when you got 10 seconds to go and there's half a nose yet to go into the yard, it's quite difficult for someone like me who's an enthusiast and inclined to shout when excited to keep calm. There's no doubt that I did get overexcited at times, but in between times I tried not to prattle the whole time. People still, when I was trying, were telling me I talked too much, but that's the way it goes. You're probably finding the same thing right now, Jesse.
No, you're all good. I was just thinking, actually, someone sent me an email today asking if I had any interview advice, and all I could think of was not to be afraid of silence. If there's enough going on, people won't mind if things are quiet for a bit, and sounded like you had the same approach on A Dog's Show. Yes,
very much so. Let the action develop, and if you need to interpret. If you need to build up the suspense a bit, then do that. That's part of the job. But don't talk the whole time, if at all possible.
Richard would like to know, was A Dog's Show filmed on just one farm, or did it tour around the country?
We toured in the sense that we have different locations every year in different areas from Northland to Southland, and many places in between. I think most provinces over the 17, 18 years of the series we were in, Taranaki, New Palmerston North, Royal Manawatu, Hawke's Bay, Marlborough, Canterbury, Otago, Southland, and on it goes. Yes, we certainly tried to move it around because it was always the responsibility of that area council of the New Zealand Dog Trial Association to run it from a dog trialling point of view. Television's responsibility, of course, to provide the necessary equipment and the expertise, and the Dog Trial Association to select the competitors based on the previous year's championship results.
Let's go to a clip now from the show. This is you, John Gordon, commentating the 1981 final.
We're back on the hunt now, but it could be crooked. Got to settle down. There's too much pace here. The dogs had to get in and niggle those sheep. They went through the markers, nearly pushing one over on the left. But there's points off there.
That's great. Gee, those whistles are impressive, aren't they?
Yes, they are. They've got to compete with the sound of the dog, and also by that stage at the top of a course, they'd be about 120, 150 metres away.
One of the best things, as we said, was when there was no commentary and all people could focus on was the sights and sounds of this show. Somebody on text, Roz, says it was brilliant, what they call non-gimmicky television, filmed in a way that you could really appreciate the farmer and the dog's skill, and nice long takes so the suspense could really build up. And as you were watching, this is what you were hearing.
Kia ora koutou katoa. Good afternoon, everyone. Apologies for the slight delay with us being based here in Auckland. I'm just making sure I have the most up-to-date information for you. As you will have seen, we have had a border case of a managed isolation quarantine worker reported today. Dr. Ashley Bloomfield has provided a briefing on that already this afternoon. So my intent today is to focus on the 23 cases that we've seen at our borders today, 17 of which have been reported as having arrived from India. While New Zealand continues to enjoy effective elimination of COVID with no community transmission, the same is not true of the rest of the world. In fact, World Health Organization global reporting shows that in just the last month, cases of the virus have been on the rise again internationally, after falling steadily over January and February, with surges in cases particularly in Brazil and India. Parts of Europe are going back into hard lockdown after a spiking of cases, with the highly transmissible UK strain taking hold and spreading throughout the continent. We are starting to see this global trend mirrored locally in those arriving in New Zealand. Through late January until recently, our 7-day daily average of cases in managed isolation had been sitting at roughly 2 to 3. This was obviously a manageable level of cases, and it's not placed significant strain on our system or indeed on our specific quarantine facilities. However, since March, the rolling 7-day average has steadily risen to around 4 to 5 cases a day, and yesterday the rolling average was 7, a high we haven't seen since October last year. As we know, New Zealand is not immune to the virus, especially with an active pandemic raging outside our borders. It has been our strict border defences that have helped to keep COVID out, and it is to the border we again look to manage this global spike. Over recent weeks, the government has been reviewing our border settings to better understand what we can do to better manage the risk as we see this surge offshore. While day zero testing is picking up cases immediately and moving people to quarantine, which reduces risk of transmission, ultimately we do want to see fewer cases arriving in general. As we've said all along, pre-departure testing, whilst a helpful tool in this regard, is not fail-safe. Advice is that people are likely getting the virus following their test as they travel to the airport and before they board a plane. As such, I have asked officials to provide me with advice for the improved management of arrivals from high-risk countries. In the interim, I'm announcing that we are temporarily suspending entry into New Zealand for travellers from India. This will take effect from 4 p.m. on the 11th of April, this Sunday. That allows us time to draft the legal orders that will be required. This temporary suspension will remain in place till the 28th of April. I want to emphasise that while arrivals with COVID from India has prompted this measure, we are looking at how we manage high-risk points of departure generally. This is not a country-specific risk assessment, but of course a risk assessment generally to ensure we better manage the number of cases that are coming in from those countries that are experiencing a surge. During this temporary suspension, the government will investigate options to manage risk, and while, though, we have put in place previous travel bans on countries, we have never previously suspended travel to New Zealand citizens and residents. That's why I do want to assure you this is not a permanent arrangement, but rather a temporary measure until we are able to better understand and manage the current situation we are facing, and to see if there are ways to reduce the risk that actually travellers themselves are facing as they embark on their journeys to New Zealand. Look, I'm now happy to take questions.
Why did you go straight to a ban rather than considering an isolation period and that end?
Well, first of all, it will be a suspension. We're taking the time until the 28th of April to see if there are other measures that we can have confidence in that may be able to reduce the risk. You've raised the idea of pre-quarantine before people depart. One of the issues again there would be we would not necessarily be able to run adequately those facilities up to the standard we run in New Zealand. So it's not necessarily guaranteed that that would reduce the risk we're seeing. These are the kinds of options though we want to explore while we've got this temporary suspension in place.
This is something epidemiologists have been talking about for a while, addressing the high-risk countries. Why has it taken till now to look at it?
Well, first of all, I again acknowledge that you'll have heard us say for some time we have been concerned about what we've been seeing from high-risk countries. For the most part, pre-departure testing has reduced down the number of cases we've seen coming in. But from some countries, in particular, unfortunately, India, that has not been reducing the numbers. We have looked into whether or not we have issues with the accuracy of pre-departure tests. That has not demonstrated that that is where the problem lies. So this suspension gives us a bit of time to look at the issue more generally.
You've said before many times that you can't stop New Zealand citizens coming home and residents. Why can you do that now?
Yeah, and that's why this is a temporary suspension. We do have obligations to allow citizens to return to New Zealand. We're using a temporary hold so that we can assess whether there are other options to reduce the risk and equally reduce the risk for those who are travelling. It's clear to us that the act of coming into areas of high congregation in order to be tested and travel is presenting risk to travellers. Genomic sequencing from ESR suggests some of our recent arrivals very much contracted COVID immediately before they travelled rather than mid-flight. So we want to see if we can reduce that risk for people.
Could it make some people really upset?
I understand that.
What would you say to those families or people who are desperate to get home and now have to wait for a long time?
I absolutely understand, the difficulty that this temporary suspension will cause. I understand that, but I also feel a sense of responsibility and obligation to find ways to reduce risks that travellers are experiencing. That evidence is telling us that because the day zero tests are picking up a lot of these cases on arrival, the majority of which today, that's telling me people are getting sick in the act of travelling to New Zealand, not on the plane, but literally the act of coming to the airport in order to leave. I don't want people experiencing that risk. We're looking at ways to find risk management tools so that we can reduce that round, if possible.
It could take some time for those risk management tools to be put in place, and potentially longer than what that suspension period is. Could that be extended?
Yeah, look, I can't at this stage rule that in or out. One of the things I'll need to get advice on, again, because this is applying to everyone, you know, it does mean we are limiting our own citizens' ability to travel back to New Zealand. And so at this stage, I cannot answer whether or not it would be any longer. But it is not our intention that this be a long-term tool. Because that simply wouldn't be for a long period of time. That's just not something that we are able to do to our citizens. We're using this temporary period to try and find ways to reduce down the number of cases, though, that we're seeing.
Are you looking at any suspensions from other nations as well?
Not at this stage, but there are other high-risk countries, and I do want to emphasise this. You know, we're seeing surges in other places, but we just don't have the high number of travellers from those places that we're seeing that are coming particularly at present from the region. So that's why we've got this temporary suspension here. If we saw it in other places, we would equally look to do the same.
How long are you comfortable extending it for if you needed to?
Oh, look, that's at this stage, we're not. It is to the 28th of April. If there's any change in that, of course, we would communicate it. But we'll use that time well. It may be that there are simply no other practical ways to reduce the risks, but we want to exhaust every option because it not only keeps those who are travelling safer, but of course reduces the risk in our managed isolation facilities.
So could it be that you have this suspension period and then make no changes out of it?
Of course, I'm hoping that there are further things that we can do, and that's the whole reason for this. At this stage, we have not in our investigations identified that there's any particular issue, for instance, with fraudulent testing. People are undertaking tests before leaving, so we haven't identified anything obvious with our current arrangements that are contributing to the problem. However, we have to do better, and that's what we're using this time to try and find a way in which we can.
During the suspension period, will you continue to be receiving travel exemption applications from migrants stuck in India?
I would say that actually for the period of time, my expectation would be no. I wouldn't want to say that hard and fast, but for the most part, from the time that someone applies, finds an MIQ placement, gets an exemption through, it would probably be, you know, close to the end of the suspension period.
Is this about capacity of our quarantine? Is it not up to New Zealand to have enough quarantine spaces for people who need to come home?
Oh, we have the capacity. We have, for instance, space in our quarantine facilities for people to make bookings now. This is about saying everything we've done has been about trying to reduce risk as much as possible. We've moved in recent times to trying to reduce that risk at the point of departure. So we're looking again at whether or not there are more things that we can do from the point of departure to reduce down that risk.
So I'm just talking about the quarantine, like as in the jet park, you know, the facilities for people who are sick or positive. Is there space in those?
Yeah, that is not the reason we've done this. We have the capacity, we have the expertise, and we have the facilities. But again, you know, it's very clearly from the fact that we've had, you know, over 60 cases in the last 2 weeks. Very, very clearly an issue that needs to be addressed if we can. I want to make sure we leave no stone unturned.
What kind of changes are we talking about?
Well, at the moment, obviously, we've done that first cut of pre-departure testing. And at this stage, you know, it hasn't demonstrated that there's any use of misinformation there in that pre-departure testing. One of the things I want to look at more thoroughly, though, is whether or not we're using the same kinds of PCR testing to the same degree that we use in New Zealand. And if we're not, if there's something we can do to rectify that. There is also the issue of actually it being the 72 hours before you travel. So are there things that we can ask of travellers in that period to, again, reduce risk? There's also the possibility, of course, of whether or not, you know, if people, their first point of departure is India, but they transit somewhere else, whether or not that can also help reduce risk. So we'll explore options.
So at the moment, if somebody has transited from another place, but they've been in India, say in April?
So the order will apply to those who in the last 14 days have been in India.
The Director General doesn't know how many border workers are yet to be vaccinated, do you?
So we've had the majority, over 80%. What we'll be working through from Monday onwards is the closing window for workers who have not been vaccinated to be moved into other roles. We've always said that there would be a time allocated for people to be vaccinated, and those who are not will not be able to remain in a high-risk environment.
Were you surprised that this worker hadn't had at least one of their jabs?
Yeah, so my understanding, and this was referred to by the Director General, is that efforts had been made, but for various reasons there had not yet been a vaccination. I have asked the Ministry of Health to put out a little more detail on that, if they can, before the close of play.
Were you concerned to hear that the person...
Of course, my expectation is that all our frontline border workers, for their own health and safety, are vaccinated. We gave a set amount of time for that to happen, for those who wanted to work through information, to have time to be vaccinated. But as I've said, from Monday we start beginning the process of those who have not being moved into other roles.
And so the Director General of Health was saying 90 to 95% had been vaccinated, you were saying 80%.
I've said over 80.
Oh, over 80.
Yep.
Tomorrow marks a year since MIQ was set up. What comes to mind when you think about how that system has operated over the past 12 months?
Very successfully. You know, over 130,000 people have come through our managed isolation facilities, and the work of our frontline workers in keeping New Zealand safe by working in those facilities in a level 4 environment, you know, for that period of time has been extraordinary. And so my first response to reaching these milestones for our managed isolation is to say thank you to them. It has been a difficult period for those workers.
Is it over 80% or 95%?
So the difference in numbers will be those who are working at ports, airports, versus those working at MIQs. The vast majority have been vaccinated. Some will be government agencies, some, however, as in this case, will be someone who's working for a private company. In those cases, the private company is obliged to make sure that individuals have been vaccinated. From next week, we start working through the individual data to ensure that those who we expect to be vaccinated have been. If they're not, they're moved on.
Going back to that 1 year milestone since MIQ, is New Zealand the only country in the world to have done MIQ successfully?
There have been, of course, Australia has been operating managed isolation facilities in the same way we have. I find it hard to find too many others that have. There are examples in the Pacific. Sometimes they have different lengths of quarantine attached to them as well. And in parts of Asia, there are expectations in some cases about different groups either being in hotels or isolating at home. But there's certainly not many, which is why, you know, developing the protocols around infection control, how we look after people's mental health and well-being while they're isolated in a small room for 14 continuous days, and keeping those workers in those places safe has been an enormous challenge. And so to everyone involved, we do owe them a debt of gratitude.
Half of our cricket team is in India at the moment, and there's a test final in England mid-June. What assurances can the government give that you'll be there?
And look, these decisions around travel into high-risk countries generally will come down to individuals, but also if it's a workforce, their employers. So those are judgments they need to make. We can do everything we can to supply up-to-date health information, and of course, if they meet the protocols and the criteria, to be vaccinated before departure. All right, last one.
Why is the Grand Millennium staying open when the Pullman was closed with sort of similar mysterious cases among people working there?
In each of those situations, that will be an assessment where experts and our technical advisors will come in and look at the circumstances, make a judgment on whether or not they consider it safe to operate. Sometimes that will be with reduced capacity if they've isolated a particular issue, or if it's more widespread, it may be that it's reduced down altogether. But we really rely on that expert advice to suggest to us how best to deal with any issues that arise.
Are you comfortable that it's still open?
Thus far, those who have the technical expertise have been very good at identifying whether or not, for instance, smaller closures within parts of a facility or a total facility need to be shut down. They know our risk tolerance is very, very low, and they act on that. Last one.
Why hasn't the Ministry been proactive in releasing future vaccination targets
Oh, well, yesterday you will have seen that actually we produced and released the dashboard for vaccination and our rolling plan.
That was very broad. It wasn't very specific in terms of the exact timeline.
Well, in some cases that will be, of course, factoring in that we are not always clear on the final timeline for delivery for our vaccines themselves. We have general indications of when tranches will be coming through within quarters, so we've made general assumptions around that. We've also made our assumptions based on the DHB's plans around their rollout within each DHB. But you can see we're not dissimilar to other countries in what we're able to provide based on the information we have from the pharmaceutical companies as well. Okay, thanks everyone. Oh, it's a stretch.
Are you building public houses fast enough?
If you compare from when we came into office, where we had something in the order of 300, to the order of in a year closer to 3,000, we have certainly scaled up at a rapid pace because we needed to. We have a housing crisis. Thanks everyone.
Thank you.